My name is Dr. Jacqueline Kitulu. I'm a general practitioner for the last 24 years. I have today partnered with Ponea Health on this educational video on diabetes mellitus. So what causes diabetes? So even as I explained what diabetes is, I sort of explained what would cause diabetes. So in the type 1 diabetic, and we've already talked who's a type 1 and who's a type 2, in a type 1 diabetic, you will find that it is just an abnormality, a random abnormality that occurs where there is no insulin production. However, in type 2 diabetics, you find that it tends to run in families. So you'll find there is a family history of diabetes. So that is the type 2, or what in other terms, in other books may call adult onset diabetes, though this term we are using less of it because you can find children who have type 2 diabetes. So number one, it has a familial link, or something running within families. And then there's factors which will predispose you to it. And those are, one of them is being overweight, being sedentary in terms of minimal activity. And we find many of us today do very minimal activity. You come into your office, you drive to your office perhaps, then you sit at your desk for 8 hours, then get back into your car and drive back home, and then sit in front of the TV or something like that. So all that is a very sedentary lifestyle. So those are some of the predisposing factors to diabetes type 2. There is also diabetes that can be linked to certain medications. So drugs which are steroids, and steroids are given for various reasons, but those are drugs which have to be very carefully monitored, because high-dose steroids or sustained steroids will cause diabetes in some patients. So those are a few causes of diabetes. So what are the symptoms of diabetes? So diabetes is interesting, but there are some classic symptoms which are quite common. Now, because of the high blood sugar, remember we talked about high blood sugar? That high blood sugar causes a number of things to occur. One, because the sugar levels are very high, they are passed in the blood and washed out through the kidneys and into the urine. So the urine that is full of sugar causes one to want to go to the bathroom very frequently. So that's one of the symptoms that we'll find, and what we call polyuria, that you're passing large volumes of urine many times. There's, as opposed to when you have an infection where you may go many times but little amount, but with diabetes, it's large volumes of urine and you're passing it many times. Another symptom is what you may have read, and I'll use the terms that you see so that you can also familiarize yourself with those terms. The other is polyphagia. So polyphagia is increased appetite. And why is there an increased appetite? It's because, remember, the blood sugar is there. You've eaten a meal. It's been broken down to the sugar. The sugar is in the bloodstream, but there is not enough insulin to push it to where it needs to go. So your muscles, for example, which if you are active and running about, you need a lot of energy. That's so the sugar or glucose should go into your muscles. But if the insulin is not able to push it into those muscles, then what happens is that, your body is constantly craving an energy source, and that makes you quite hungry. So you're trying to eat more to create more energy, and you're only getting minimal into the system. So that is another symptom, the polyphagia. Then you'll find there are patients who will lose a lot of weight because, again, it goes back to that point of not being able to consume the blood sugar. So what happens is their bodies begin to break down their muscles to try and provide some energy. So some of the diabetics become very skinny and lose weight. And that you'll find usually in the type 2 diabetics, that it may have been a much bigger person and they begin to shrink away. But then others may also gain weight. So it can be on either side. So, and the weight gain is, of course, is because they are eating more. Remember, they are more hungry, so they also gain more. So thank you very much for having joined in this series, listening to hypertension and diabetes. It has been my pleasure empowering you to manage your hypertension or diabetes at home. You can reach me through ponea.com for my services for managing your hypertension or diabetes. Karibu.